Welcome to Lesson 6 of Module 8, Non-Infectious Diseases and Disorder, and in this video we're looking at future directions. In our previous videos, we've looked at a few different types of non-infectious diseases, and in this video we're going to take one in particular and look at some of the treatment and management options that are available and some possible future directions. In this video alone, we are going to use just one example of a disease, but that does not mean that you can't do others in class or that your teacher in your classroom may have done a different one to this one, but this is one that you may choose to use for this section. So when we talk about some of the meta language we're going to use in this video, we are going to look at treatment and management. So when we look at treatment, it's strategies that help to either cure the disease or relieve its symptoms. And then when we talk about management, it involves interventions or programs that improve the patient's overall quality of life when there is in fact no cure. When we talk about treatment plans, these are multidisciplinary teams that work together to treat and or manage the disease. And it can be based on the overall health of the patient, the type and the stage of the disease, the location and the severity of the symptoms, and the personal preferences of the patient. And we can see here the example in this slide is on breast cancer, and there are some really local and then some systemic treatment plans. And again, depending on the type, the stage, location, and the personal preference, a person may undertake one, all, or none of these treatment options. The case study we're going to look at in this video is about melanoma, which we've looked at in our previous videos in relation to skin cancer. So when we talk about treatment, in this slide, we're looking at radiation or chemotherapy. When we talk about radiation, it's when cells are exposed to X-rays that can repair their DNA more easily than cancer cells can. X-rays damage the DNA of the cancer cells and therefore then kill them. So when we have radiation directed to the specific cells, they do in fact intend to destroy them. Radiation can either be administered externally or by a radioactive source in the body near the cancer cells. Chemotherapy, however, is the slow growth of cancer cells that allows us to treat something like melanoma. When we talk about chemotherapy, it can either be orally through a needle or as a cream, and it has a large number of side effects, so it is dependent on patient health and other factors which may influence a person's decisions whether or not to have chemotherapy. Some other treatments, we can have targeted therapies and immunotherapy. When we talk about targeted therapy, it's the use of drugs that affect the molecules that can control the growth of the tumour cells. If the targeted therapies are used correctly, it can stop the growth and spread of the tumour to other organs. It does interrupt the pathway that causes the uncontrolled division of melanoma cells. And immunotherapy is using the body's own immune system to fight the melanoma. We can have some checkpoint inhibitors and vaccinations here. So a checkpoint inhibitor is where the immune system recognizes and destroys the melanoma cells that would normally be ignored. And if we use vaccinations, it's when an antigen is produced using the melanoma cells, and therefore when injected allows the immune system to more easily identify and destroy the melanoma cells. Some future directions for skin cancer and melanomas in particular. So targeted therapies require more research so that we understand all of the different types of mutation that may cause uncontrolled cell division. Further drugs will then be developed once there is more research, and it can disrupt many more of these pathways than we already know about. More research is needed into immunotherapy and the relationship between melanoma and other cancers so that we can use those to inform our future direction of research, but also how we might treat and manage these diseases into the future. That concludes Lesson 6. Make sure you tune in for Lesson 7.